Now, let's proceed to the symptoms and what are the possible ways or solutions that can be done to help those person that is suffering from TBI or traumatic brain injury. But before that, I want to introduce myself first. I am Libon Jan Miguel of BSA 2A Filipino major, and I am currently studying at Sabela State University. As you can see or notice in my ID lace. Hindi naman na kailangan yun, pati yung sinali. Now, without a further ado, let's start our discussion. As you can see behind my back, umpisahan nating talakayin ang symptoms of traumatic brain injury. So, what are the possible symptoms that can be seen to those persons that suffers from TBI? Usually, symptoms is defined as a mark or sign that can predict or that can lead to what are the possible things that may happen in the future. Usually, it is a lead kung ano yung mga pwedeng mangyari. And it is also a bagay na tumutulong sa'yo para malaman kung ano yung parang mas susunod na mangyayari. Parang ganun. Symptoms. Usually, symptoms is very, very important in identifying a lot of problems, especially in health. Kasi pag nakitaan ka na ng symptoms, you can easily identify what is your problem, what is the problem with you, usually. And let's focus on symptoms in TBI. When we say symptoms in TBI, I can usually classify it into three, which is the mild, the moderate, and the severe. Usually sa mild, mas simple yung maaring makitang symptoms. Siyempre, pag severe, mas malala. And unahin na nating talakayin, next slide, yung sinasabing, oh my God, usually binasa ko talaga yung symptoms ng TBI for mild. And napansin ko, a lot of listed symptoms are usually, I have this kind of symptoms, but I'm not saying that I have TBI. Mahirap sabihin. Usually as a student siguro, normal na lang rin tong mga symptoms na sa amin. And because of the distance learning, it add additional stress for us student. For example, one symptoms of TBI or traumatic brain injury is the inability to remember the cause of the injury or events that occurred immediately before or up to 24 hours after it happened. Or usually, isang symptoms daw is yung hindi na natatandaan kung ano yung nangyari. Usually, yung mga pangyayaring nakasakit sa kanya or within a period of time, usually 24 hours. Another one is confusion and disorientation. Palaging naguguluhan. Usually kasi, syempre, traumatic, parang trauma, and brain, utak sa utak, and injury, parang something sa utak talaga, no? And you know, guys, brain is the most complex part of our body. It is the seed of knowledge, and it is the one who controls our movements. So parang ito talaga yung pinakapuon ng pagkatao natin. Yeah. Yun na nga. Another one is headache. Headache. Pero hindi ko sinasabing if you feel this kind of symptoms, if you have this kind of symptoms is may TBI ka na agad. Of course, there's a lot of examination na gagawin pa para maklasify ka as one of the person who has traumatic brain injury. Another one symptoms is dizziness. Dizziness, palagi naantok, tinatamad, parang ganon. Sinong nakakaranas ng ganon? Blurry vision. Usually ako, marami rin ako kakilala. Pero tingin ko kasi tutok sila sa ML. Charing. Usually kasi distance learning sa aming mga students, normal na lang siguro rin yung lumalabo yung pagtingin kasi palaging tutok sa cellphone. But it is one symptoms pag may blur vision ka. Ingat-ingat. It is one symptoms for TBI. Another one is nausea and vomiting. Usually, Ito mababasa nyo rin naman sa screen. Binabasa ko lang sa laptop. Nausea and vomiting. Pagsusuka. Naduduwal, ganun. Yung nausea, hindi ko alam yan. Pero yung vomiting, yun yung pagsusuka. That is another one symptoms for a person who has TBI. Another one is ringing in the ears. Parang may naririnig na hindi dapat marinig or may nagre-ring. Usually, gano'n. Another one yon. And trouble speaking coherently, yung nabubulol or hindi diretso yung pagsasalita. That is one symptoms, kaya yung mga ano dyan, siguro. But tandaan nyo, ang pagkakaroon ng TBI is hindi siya kasalanan. Usually, hindi naman kasi makokontrol ng tao. It's because a lot of stress siguro na nararanasan ng tao kaya nagkakaroon siya ng TBI or traumatic brain injury. Kaya pag may traumatic brain injury ka, hindi mo sabing baliw ka, malayo ang pagiging baliw sa pagkakaroon ng traumatic brain injury. And it is not a disease also. I think it is more on mental problem or mental stress na lang, sabihin natin. Another symptoms, back to symptoms is changes in emotion or sleep patterns. Oh my God, sino ba yung sa inyo? Changes of emotion, kunyari, una, masaya, tapos biglang magagalit, saya, biglang malungkot, biglang sobrang excited. Yeah, it's like a pickled emotion. Pickled emotion, paiba-iba yung emotion. That is another symptoms. And yung sleep patterns, paiba-iba yung sleep patterns. Usually kasi, pag ang isang tao is sleep routine niya is every 6 and gigising ng 6 a.m., that is usually sleep routine. Pero usually, pag yung isang tao natutulog ng alas 6, susunod, alas 8, susunod, paiba-iba, ingat-ingat, that is one symptoms na ng pagkakaroon ng traumatic brain injury. Next slide. Ang sabi dito, babasahin ko na lang. Mababasa nyo rin sa screen na syempre background. These symptoms often appear at the time of the injury or soon after, but sometimes may not develop for days or weeks. Mild traumatic brain injury symptoms are usually temporary and clear up within hours, days, or weeks. However, on occasion they can last months or longer. Moderate traumatic brain injury causes unconsciousness lasting more than 30 minutes, but less than 24 hours. And severe traumatic brain injury causes unconsciousness for more than 24 hours. Symptoms of moderate and severe traumatic brain injury are similar to mild traumatic brain injury, but more serious than long and longer lasting. Usually, yung sinabi dito, yung symptoms ng mild traumatic injury, same lang siya sa moderate and severe, but usually sa moderate and severe naglalas siya for 24 hours or more longer than usually sa nararanasan sa mild. Kasi sa mild symptoms usually 30 minutes, hindi siya nagtatagal ng 24 hours. Mas maiksi yung time ng pagkakaroon ng masakit na ulo or palaging naantok. Hindi siya it is only a short period of time compared to the symptoms. Mas mahaba, mas longer. Next is, I have to play a video of I think 1 to 2 minutes lang naman on discussion about the symptoms of TBI. Let's watch this. At yun nga, napanood yun na yung video. They usually talk about the symptoms, right, ng mga taong nakakaranas ng TBI. Now, let's proceed to the treatment. Ano nga ba yung ginagawang treatment para sa mga taong merong TBI? Usually, treatment depends on how severe your TBI is. Usually, sa mild traumatic brain injury, ang best remedies for it is to have rest. and relax. Usually go back to your healthy lifestyle and try to have rest kasi may papayo rin yung kailangang bantayan. Usually pag nagpapahinga sa bahay or kailangang bantayan yung taong yon, take more extra effort on caring kasi maaring lumala pa yung symptoms, kaya doble ingat at pag-aalaga sa mga taong merong TBI. And yun. Now, meron rin yung tinatawag tayong immediate emergency room. Kung mababasa natin sa background screen natin, immediate emergency room is usually given to those person who have severe TBI or traumatic brain injury. Tandaan natin because they have to maintain their blood pressure, they have to make sure that they have enough oxygen supply, and preventing further injuries from neck to head. It is really important. And they also offered this kind of intensive care unit room for them to prevent what we call secondary damage due to the inflammation and bleeding or reduced oxygen supply to the brain. Now, let's proceed to medication. Medication is one of the most important treatment to treat those person who suffers from TBI, traumatic brain injury. And you can see behind my back, there was 3 medications, right? The first one is the anti-seizure drugs. Anti-seizure drugs prevents one person from having a seizure. Usually, those person who have TBI tends to cough and usually nanghingisay, parang ganon. And it's really effective para sa mga, this drug is really effective para hindi mag-collapse yung isang tao. And the second one is the coma-inducing drugs. It's all about putting one person in a coma stage, in a coma. Parang patutulugin ka, usually. Ito yung parang patutulugin ka because pag tulog ka, pag nasa parang coma stage ka, your brain needs less oxygen and it is really helpful in blood vessel, right? Yun yung pagkakaintindi ko dun sa definition ng or kung paano ma-define yung coma-inducing drugs. But the way, pangatlo is diuretics. Diuretics is defined, babasahin ko na lang. These drugs reduce the amount of fluid in tissues and increase urine output. Diuretics give intravenously to people with traumatic brain injury, help reduce pressure inside the brain. So that is the 3 types of medication. The first one is the anti-seizure drugs, the coma-inducing drugs, and the diuretics. Now, let's proceed sa tinatawag na surgery. Surgery, it is yung tinatawag na last hope. Usually, pag hindi na makuha sa relax o pahinga, pag hindi na makuha sa gamutan na pag-inom ng gamot, ang last hope na tinatawag is yung surgery o yung tinatawag na opera. It is done to prevent more damaging or it is done to prevent more damage to tissues. Usually, ang aims nito is number 1, to removing clot blood. Usually, tanggalin yung mga namuong dugo sa utak. Second is repairing skull fractures. Usually, nangyayari to sa mga naa-aksidente. Pag nadidisgrasya, may nabibitak yung utak. And surgery is their last hope. Ang ginagawa na operahan, then they try to fix it. They try to fix it. And another one is bleeding in the brain. Mababasa nyo naman sa background screen natin. Bleeding in the brain, usually sa katulad ng mga unexpected events like yung may naputol yung ugat sa utak or pumutok yung ugat sa utak, may nagkakaroon talaga ng pagdurugo. So they need to they need to operate and they need to have a surgery to remove that certain blood in the brain para maiwasan yung pagkalat and masira pa yung brain tissues and opening a window in the skull. So this is just simple aims. There's a lot of reasons why they are conducting a surgery, but this is just a few. And it is really important. Ito yung tinatawag na agarang gamutan. Usually, if they don't perform a surgery, one person might die. Now, let's proceed sa tinatawag na rehabilitation. Rehabilitation is one of the most important and friendly way of treatment. It is simply because you have companions na masasandigan. And I think it's either before and after rehabilitation. This can apply for those TBI who engage to a surgery. Kasi pagkatapos ng surgery, they have to rehabilitation, for example, therapy. And pwede rin sa mga taong gusto pang sabihin natin maagapan na lumala ang kanilang traumatic brain injury, kaya nagpaparehab na sila. It is usually learning about the basic skills and how life works every day. It is about regaining and I think strengthening. That's why rehabilitation is one of the most, and I think my favorite treatment among I stated earlier na medications sa mga taong may traumatic brain injuries. And dito na lamang po natatapos ang aking report. And I will just flash the individual personals na may kinalaman sa rehabilitation or sa pagtitreat ng taong may TBI or traumatic brain injuries. So, bye-bye!